The COVID-19 pandemic is aggravating a nursing shortage in California that is expected to continue for a few years. In tonight's KPIX5 original report, Sharon Chin on the statewide prognosis and the training preparing new graduates for the future.
Nurse Stephen Laborde of Louisiana has traveled to COVID hotspots in hospitals across California. He almost quit when one failed to supply enough PPE.
And that was at the time where nurses were dying in New York and everything. And you were like, we could actually die from this.
He wasn't the only one worried. According to a UCSF survey, 26% of California nurses between age 55 and 64 said they plan to leave in the next 2 years. That's double years past.
The surveys we'd been doing.
Dr. Joanne Spetz co-authored the report from last year's summer surge. She says some nurses cite stress and shifting priorities.
I want to serve. I'm going to help my community through this pandemic. And when this is over, I'm going to spend time with my family and I'm done.
The report forecasts a shortage of more than 40,000 nurses, a 13% drop statewide.
We think that this is going to result in persistent shortages for about 4 or 5 years.
So hospitals are hiring often more expensive traveling nurses. Aya Healthcare reports there are 40,000 traveling nurse jobs open nationwide, a 77% increase over last year. More than 4,000 of the jobs, or 11%, are in California, the state with the highest demand. As a traveling nurse in intensive care, Stephen faces the most critical COVID cases.
I've never seen that many people die as in this year.
But unlike staff nurses, Stephen can take a break between 3-month assignments.
You're getting burnt out, but it's like you at least have a finish line. You know, like, oh, like my contract is till May, I just have to make it till May.
While traveling nurses fill the short-term gap,
finishing that focused assessment.
Long-term, there's hope in a nationwide jump in nursing school applicants.
You're talking about dancing on your feet fast.
At Santa Rosa Junior College, Administrator Dr. Catherine McGee expects more interest in its 120 nursing program slots this year, since they took no applications in last year's shutdown.
If we get 400 to 500 applications, maybe we'll get 400 to 600 applications.
Use your call button if you need anything in the meantime.
Students like Christina Croco are ready to work.
You know, shortage or not, I feel like those of us that have continued on with school, we really have a passion to move forward.
And more graduates are trained to avoid the burnout that's led some nurses to bail out.
The trend in nursing education is towards building resilience.
Nurses and educators also hope hospitals will provide incentives to keep nurses on staff and mentor new graduates to help keep their numbers in stable condition.
Her heart rate is still good.
Sharon Chin, KPIX 5.
Other factors adding to the shortage of nurses, operating rooms opening up again, and more patients returning to hospitals.